Thank you, Madame. All right, so welcome again to the Fall Reentry Cafe for the Patton campus. Before we get started, I would like to go over just some meeting norms. First, in order for everyone to hear properly, if you could please mute your microphone. Questions, there will be a question and answer period at the end of the presentation. So please, as we are going along, you can enter your questions within the chat box. Some of our team members will answer, but I'll look through at the end of the presentation and then we'll answer those questions. We will not really entertain any private or personal questions. It wouldn't be addressed in this forum. So I ask that if you do have any of those questions, you email myself or any of our staff members. So I always want to show this picture because it reminds me so much of the students that I miss very much. These are my second graders who are now third graders. This is the reason that we do this work, or that I do this work and my team does this work, because of the smiles that you see in this picture. So I just want to say I miss all of the kids, all of our staff. We miss you very much. And it brings me joy to know that our students will be returning soon. I want to give a huge thank you to our families, first of all, for being a part of the Lycée family, our new families and our returning families. Also want to give a huge shout out. This work could not be done without giving a huge shout out to teachers and staff for all of the work that you continually do each day, and being creative and solution oriented during this time. The other thing that I would like to say at the beginning of this is that we apologize if there was some confusion with the surveys. For the survey for the Patton campus, you have until the end of the day today, 11:59 p.m. midnight, in order to put in your choice for the survey. So I just want to say that, and I just want to say thank you for your patience. I'm also going to put a plug in for the Dads Club, a huge thank you to the Dads Club. They will be at the Patton campus on Saturday, putting some finishing touches on the building. So I want to say thank you to the Dads Club for all the work they do to support our school. And the PTO also for the work that they continually do to support our efforts with the school. So the first slide we want to talk about is reopening and the dates for the reopening schedule. The first date is October the 19th, which is for pre-K students, Group A, and for all kindergarten students. The second date will be for October 20th, which is pre-K students, Group B. And October 26th, first grade and second grade students will begin. So again, October 29th, it'll be for our pre-K students, Group A. All kindergarten students will start on October the 19th, and October 20th, it's pre-kindergarten students, Group A. October 26th will be first grade and second grade students. And just if you're asking a question like when will those groups be provided, we will provide information on groupings and classes basically the week of October the 5th, which is next week. So our school hours and arrival. School hours are 8:30 a.m. to 4:20 p.m. Arrival times are as follows. So for AM, our buses will come in on Patton Street, which is the front of the school. For carpool will happen on the playground, which will be between 8:05 and 8:30 a.m. Just note that temperature checks will be taken prior to a student exiting the car, and that temperature must be lower than 100.4. For drop-off, that time is between 8:05 and 8:30 a.m. and temperature checks will be taken upon arrival. Again, that temperature check must be lower than 100.4. For pre-K students will enter through the Patton Street driveway, which is exactly where all pre-K students have come to pick up material supplies. For the kindergarten students, they will enter through the side Patton Street gate, and we'll provide a map of this for parents. The side Patton Street gate, which leads to the kindergarten classroom sliding doors. And then first and second grade students will enter through State Street gate, and siblings will also enter through State Street gate. Once students enter the building from buses, from carpool to drop off, they will go straight to their homeroom classes. We want to say to all families to please expect longer wait times during the first week back as we all get adjusted to this new schedule. Typically, our students go through the State Street gate, but each grade will now go through a separate gate. This is just a little map of where every entrance for each student will be. We will be giving a recording or posting this recording, so you'll be able to see this map, and we also will send it out to our families. So our school hours and dismissal. Our dismissal time, we end school at 4:20. However, buses for students will be called down from their classrooms by their bus color. Carpool will be in the playground, and students will be dismissed from classrooms from carpool using some of our duty personnel. And pickup this year for returning families will be a little bit different. So it will be the same as arrival, meaning the pre-K students will be dismissed from the Patton Street driveway, where the sliding glass doors where you picked up materials. Kindergarten students will be dismissed from the Patton Street side gate. And then first and second grade students will be dismissed from State Street, and siblings will be dismissed from State Streets. Again, we expect longer wait times during the first week as we all get adjusted to the schedule. So we ask for your flexibility and patience. For pre-K and kindergarten drop-off, typically in a normal year, we allow our parents to walk pre-kindergartners and kindergarten children to their classrooms. And we typically have what's called an Independence Day for students. This year, however, due to increased need for safety, we will not be allowing parents to come into the school building or come into the school gates. So we will have some staff on hand. Our new counselor, Madam Robbie Lewis, support team members, administration will be on hand to assist our younger students into classes in the morning time. Late arrival and early dismissal. So we're encouraging all students to arrive and leave during the scheduled arrival and dismissal times. Parents will not be able to escort their tardy students to the office. Our procedure for this year is that a parent or guardian can ring the doorbell. We'll wait for a staff member, typically it's Miss Katie, to take their temperature, and then they'll be escorted into the building. We want to emphasize that you must remain at the door to ensure that your child is safely admitted to the building. And we also want to ask parents to minimize the appointments during the scheduled school hour days. We know it happens. If it does happen and you need to schedule an appointment, we definitely understand. Parents can inform the school in advance. We're going to use Pick My Kid this year. We're going to roll it out a little slowly this year, but prior to, you can email Miss Katie. And Miss Katie and staff members will ensure that your child is ready if you have an early pickup. For your child will be escorted out of the building to the doors to either the parent or the guardian. And we just ask again that you give us a little bit heads notice. If it's an emergency, then we definitely understand. You just would have to ring that bell and wait a couple of minutes for us to prepare your child to exit the building. So carpool. The carpool route is very important to us at the Patton campus. Vehicles must access the carpool route via Constant Street via Nashville Lake Forest. I'm sorry, Lakebound. It is important that you enter Nashville Lakebound so that traffic is not backed up. Again, this will be sent out to parents so you know the carpool directions. Do not enter the carpool, and this is very important, do not enter the carpool line from Magazine Street onto Nashville or Eleanor to Constance. Again, I'll say it again, do not enter the carpool line from Magazine Street onto Nashville or Eleanor onto Constance, as it causes a traffic jam. There's a specific route that we would like parents to follow. We ask that you follow best practices when it comes to traffic, and be very courteous when we are in carpool. We expect our parents to follow this protocol and be courteous not to other drivers, but also be courteous to our neighbors within the area. Uniforms. So for uniforms for our youngest students, our students are able to wear red or white tops. The tops for this year, they can be monogram. However, due to the current situation that we're in with COVID, you do not have to have the shirts monogram. So as long as they have a red or white shirt and a blue bottom, then that's an acceptable uniform for us. We also ask that you ensure that your student has closed-toe shoes. So for the Patton campus, staff and students will be required to wear masks, wear cloth face mask coverings, with the exception of lunch and nap time. Staff and students can wear their personal cloth face covering as long as they are not deemed distracting. If for some reason a student comes to school upon arrival and we perform the temperature check, we will have extra masks on hand to provide to those students. Visitors, parents, families, volunteers, and visitors will not be allowed in the building, as is usually our normal process, just due to the times that we're in right now. Exceptions will be made for necessary school visits, such as ESS evaluations, NOLA public school staff, or the Louisiana Department of Education visits. As far as for room parents, we can work out with the PTO as far as like room parent visiting, that those things will have to be done virtually because we're not allowing visitors to be in the building this year. We appreciate all of the things that our room parents have done. I know some have already reached out to our teachers, so we'll try to work out something so that the room parents can help out our teachers virtually. Recess. Who doesn't love recess at the Patton campus? Our students will have 3 indoor or outdoor recesses per day, 15 minutes daily for those 3 recesses, weather permitting. Classes will have assigned specific areas on the playground, and the school to avoid mixing of student cohort groups to ensure safety. Our cleaning schedule. So our cleaning schedule, the facilities team will maintain a daily cleaning log for each classroom, restroom, shared space. High-touch surfaces will be disinfected 3 times a day, which are the light switches, your doorknobs, tables, handrails. And then full building cleaning will also be performed nightly and on Wednesdays. Meal service. So this is a great addition to basically all schools in New Orleans this year. Free meals, breakfast and lunch will be available for all students through December the 31st. Breakfast and lunch for our students will be consumed in the classroom. The adult that will be supervising could be a duty personnel or a staff member within the Patton campus. Unfortunately, this year we will not be able to have communal snack as we have done so in the past. So we're requesting for parents and guardians to pack a snack for their children based on our approved snack list. Before eating and after eating, we will have mandatory hand washing. We're asking that all students please come to school with a full water bottle each morning. Students will be able to fill that water bottle throughout filling stations within the campus. And then students within remote learning will continue to have meals available in a grab and go format for pickup. Before care and after care. So at this time at the Patton campus, we will not be offering before care and after care. And there will not be any enrichment activities after school, and field trips will not be permitted at this time. So student groupings. Students will remain with their cohort groups all day, with the exception of when they arrive during arrival time, when they're transported on buses, independent restroom use, dismissal, and busing also. And then the ESS interventions, which are the pullouts that we have. In phase 2, a maximum of 25 students are permitted within that static group. So our cohorts of students will remain together except for in these cases. I want to talk a little bit about our Children's Hospital Partnership, which is an amazing thing that we have at Lycée to be able to consult with doctors on school scenarios and policies and internal communication in reference to COVID-19. We have access to Children's Hospital's wellness hotline for our school nurses. There are online resources for parents and students and schools in general. And our nursing staff actually have support via virtual and education resources. We will be posting information about Children's Hospital and those online resources for our parents so that you can have access to them. But this is just a wonderful partnership that we have with Children's Hospital to be able to provide us with information from the health experts. So I want to talk a little bit about Children's Hospital testing and rapid testing. As a part of NOLA Public Schools testing program, all symptomatic students have priority access to rapid COVID testing via our partnership through Children's Hospital. So these are a couple of steps that we can follow in order to access this program. If a student is symptomatic at school, then basically the school will contact, when the student is at school, and the student presents with some symptoms, basically the Nurse Pam will be the first order of contact. Obviously, Nurse Pam will be in contact with the parent during this time. So Nurse Pam will have access to call Children's Hospital hotline for school wellness. Children's Hospital will be able to gather information in order to get information for the student to get testing if the parent allows for the child to get testing at Children's. And then the next step, basically, once the family comes to pick up that child, once that family arrives at Children's Hospital, they're able to get tested. And then that testing result can be provided within 48 hours to the parent. Children's Hospital is basically saying you don't necessarily need to have a pre-scheduled appointment. It's not required, but it will reduce the amount of time that you're spent waiting for a testing appointment. Children's Hospital will basically bill the tester's insurance for the COVID test. However, we are working with Children's Hospital to find out if there is not an out-of-pocket cost. However, we don't have that answer right now. Once we find out, we'll provide that information to our community. We will also place on our website just a link to NOLA Ready. There are other sites, testing sites available within the New Orleans regional area that basically provide COVID-19 testing for free. So next we would like to go through a decision tree basically that Children's Hospital has given to all schools. If a student or staff member is experiencing COVID-like symptoms, and those symptoms are here on the right-hand side, if there's a fever of 100 greater or equal to 100.4, shortness of breath, chest pains, increasing non-productive like a dry cough, body aches, GI symptoms, loss of taste or smell, or other flu or cold-like symptoms, then if that student or staff member is at school, that person or that student will go home. They're at school, they'll stay in the isolation room at the Patton campus until their guardian picks them up. And then they will take a COVID-19 test. If that COVID-19 test is negative, then that student will stay home until those symptoms improve or the fever-free with no meds for 24 hours. If once the student takes a test and that test is positive, then that student will isolate at home, stay home until the fever with no medication for 24 hours and symptoms have improved and 10 days since the first symptom has appeared. And then we as a school will notify those close contacts. The last step is returning to school with documentation. And we'll go over that a little bit more, but we are requesting documentation from families once students have gone through this decision tree process. This decision tree will be added to our website so families can access it if you would like to look at it and you have any questions in reference to it. The next decision tree that we have is for close contacts. So if a student is within close contact Basically, that definition is 15 consecutive minutes within 6 feet of someone who is tested positive. So the close contact decision tree starts off. The student will go home. They will stay isolated or stay in the isolation room at the Patton campus. The next step would be the student will quarantine for 14 days. If the student has COVID-19 symptoms during quarantine, then that student will go through the decision tree for symptomatic cases. If the student does not have any symptoms, then basically that student will return to school with required documentation. So what happens if a student or staff member reports COVID-like symptoms or comes in contact with a confirmed positive case? The first thing is to report it right away to Nurse Pam. We have her email address there, or you call the school to speak with Nurse Pam. The next step would go through the COVID-19 screening decision tree, which again will be available for our community. And then close contacts of a confirmed positive case will be notified right away. Just know that our school, lycée, works with the Louisiana Department of Health Region 1 office and Children's Hospital as a resource to help us to identify the next steps for close contact. And then the next step, obviously, the whole school community will be notified of a positive case without providing specific indicators or identifiers. So what is the contingency plan if the number of coronavirus cases upsurges in the fall? So the first thing is that we will consult health officials to ensure we have safe operations, continue to have safe operations. We will consider the guidelines from state and local officials. We always have the option to return to full virtual if needed. And if restrictions are loosened, then additional programs may be reinstated. So some of our safety protocols, and you've seen these a little bit earlier. On arrival, we'll have temperature checks, washing of hands. Students can use hand sanitizer, health and safety questions. Recess is the same, washing hands, hand sanitizer before and leaving the classroom. Lunch, washing hands, hand sanitizer before and after eating. Dismissal, washing hands, hand sanitizers before and leaving the classroom. Again, students and staff must wear a mask at all times on campus, covering the mouth and the nose, except for nap time and lunchtime. Masks should be supplied by the parent or the guardians to ensure proper fit. And we do have emergency backup masks if they're needed. The key thing that we're saying here is be able to mask up, and that's what our partners are telling us. Ensure that you have masks and washing of hands. For our little students, Nurse Pam does a great job. She will be doing some education for our students in reference to how to wear their mask and how to wash their hands so that they know what those practices are. And then you as parents, you can do that also to work with your child in reference to wearing their mask and washing their hands. So school expectation for parents and guardians. A child should never be in school if they're ill or if they're showing some type of COVID symptoms or if they were exposed to a positive case. If, for example, your child is sick at school, we just want to ensure that you promptly come to pick up that child and then follow the decision tree and the medical protocols for illnesses during school hours. As I said before, we want to be able to reinforce hygiene and safety guidelines for students, including wearing a mask, and then adhere to procedures that are set in place for safety, including arrival, dismissal, and building access. This is all of us working together as a community to ensure that, we are ensuring the health and safety of everyone. So this is a sample schedule for second grade. We'll provide some sample, I'll show a sample schedule for second grade. This is for virtual, and most of the virtual classes will be the same with some adjustments to potentially pre-K and K. So for the second grade schedule, we basically have 8:30 to 9:45 with French language classes, we have a morning break at 9:45 to 10:15. And then at 10:15 to 11:30, we have French mat class. Lunch, 11:30 to 12:30. And then 12:30 to 1:45, you have ELA class. 1:45 to 2:15 is an afternoon break. And then 2:15 to 3:30, you have French, STEM, social studies, or art. For the classes that are color-coded half yellow and green, those sessions could be live sessions or pre-recorded sessions. To the right, we have a schedule for Wednesday, which is French class at from 9 to 9:45, a morning break, and then 10:15 to 11:05. Students are able to finish that work, and then there's a STEM class that could be pre-recorded, and then afterwards from 11:30 to 12:30 is lunch. I'm going to exit out just 1 second out of that presentation and share just a second grade in-person schedule, which could be similar to first grade, and also pre-K and kindergarten, except for pre-K and kindergarten. Pre-kindergarten will have like a nap time. Kindergarten will have more of a rest period nap time. So for second grade, this is a typical schedule, which could be adjusted, but in class, basically at 8:30, students have ELA. 9:35, students have French, and that could be French mat or French language. 10:45, students have a recess. Again, students come back at 11, and they would have French again. That again could be French mat or French language arts, social studies, science. Students will come back, and then they have lunch and recess. And then 1:30, students have French. 2:30, recess, and then 2:45 to 3:45 is electives. Mind you, this is a sample schedule. Each individual class has a separate schedule that rotates between our electives and ELA teachers. So school supplies, many families have asked about school supplies. So we're asking teachers to limit the request for school supplies. The first couple of weeks, students will only need the basic supplies, and school supplies, as far as like each grade, will be communicated out to families next week as to what school supplies will be needed once students return. Transportation in phase 2, the busing capacity is 50%. Upon arrival, one bus will be unloaded at a time on Patton Street, and students will enter the building where health checks will be conducted before reporting to the classroom. This was another question that parents had. Can parents keep students home without a doctor's note if they or someone in the household have COVID-like symptoms? Will this be an excused absence? If the student has symptoms, we would ask that you follow that Children's Hospital decision tree. To excuse an absence, we will need you to provide medical documentation of a COVID-19 positive, negative test, or another diagnosis. These couple of questions are in reference to being quarantined. So if a teacher must quarantine, will virtual classes continue? Right now we're saying yes with the teacher pending their wellness, yes with the substitute teacher if they will have an extended absence. If a student must be quarantined, they may join a virtual class with an assigned, if a student must quarantine, they may join a virtual class with assigned class if the whole class is quarantined, with other virtual students within the grade level, and pending their ability to complete the schoolwork at home. So what other health and safety preventative measures are taken by the school? So as far as PPE, we have disposable and reusable masks, we have gloves, N95 masks, gowns, face shields, plexiglass dividers where needed, and other available PPE. As far as social distancing, no adult will be circulating or congregating during this pre-COVID-19 environment. And through role playing with our students, we'll encourage them to maintain safe physical distance. The last thing that I want to say is, I always say this because this is what we are about when talking to our students. This is what we push, is to be kind. In a world that you can be anything, we're asking everyone to be kind, and this is what we teach our students at Patton, so we want to kind of reinforce that. I know there are a lot of emotions about returning and not returning. We did meet with our teachers and our staff members, and there are various different emotions on different ends of the spectrum. And we acknowledge that. Again, I want to say thank you to all of our teachers and our staff members and our parents for continuing to push forward the work for Lycée and all that we do. The next slide is a Q&A, and I'll make a couple of comments in reference to class placements. All right, I'll go through some questions. It says, why is the fever threshold set at 104? It should be if there is an elevated temperature. The fever threshold is set at, oh, Ms. Katie already answered, 100.4. So Johnson's dismissal is at 3:30 and Patton is at 4:20. Patton's dismissal is at 4:20. That's our typical time frame. Between 4:05 and 4:20, that's pickup time. So you can pick up your student basically at 4:05. Question was, is LDOE doing spot checks for health protocols at local schools? LDOE is doing spot checks and has already performed spot checks at NOLA public schools. The next question, at the beginning of the year, will there be staff to escort first graders as well, since they aren't familiar with the second floor? Yes, we will have duty personnel in various different spots at the door, at the gates, to be able to escort first and second graders to their classrooms, and also in hallways. The next question is, when will there be a reevaluation regarding before and after care? We take the guidance from the LDOE and NOLA public schools in reference to before care and after care. Once we start school, we will work with our partners to understand if we will be able to do that. But as of right now, we will not be able to have before and after care. There's a question, there is no out-of-pocket cost for testing if done through the school. Let me go back to that. I had a meeting today with Children's Hospital. Rapid testing will be provided by Children's Hospital. However, it will go through the parent's insurance. And typically there is not an out-of-pocket cost through your insurance. However, Children's Hospital will be verifying for Lycée if a family does not have insurance, can the test be free of charge? We have not received that information as of yet. We had a meeting earlier today at 1 o'clock or so with Children's Hospital. And once we find out that information, we will provide to families. Teachers are exhausted. Yes, teachers are exhausted. All teachers and staff are exhausted. And we try to be able to do a lot of things about staff care. And we check in with our staff members to ensure that they are doing some things that are filling their buckets and being able to give them the necessary break that is needed. Our school starts the week after a break, so teachers and staff will have that break in between in order to refresh. Will you be asking for proof of a flu vaccine? The only proof that we're asking for right now is just proof, if you go through the Children's Hospital decision tree, proof of a positive or a negative case. As of right now, we're not asking for proof of the flu vaccination, but I'll put that one down as something that we can speak with our partners. The question is, are we notifying the entire school if a teacher or student comes up positive? So if we are notifying the entire community if someone within the community tests positive. We're only notifying the specific class or grade if they were in close contact with that person that was positive. Next question, what documentation will be required after 14-day quarantine resulting from exposure? If a full quarantine is done, why would a doctor's note be required? Seeing a doctor was not on the map. I'll have to go back to the chart, Darren, but I think it's more of if you have symptoms, right, and you're tested, if your test is negative or positive, we would like to have that documentation so we ensure that the person that's coming back has a full bill of health or a diagnosis saying what that is, if it's flu-like symptoms, if it's strep.
Hey, Danielle.
Another question. Ginger, can you hold for 1 second?
Yeah, I can help you answer that question if you.
Okay, go ahead.
Yeah. So if you do the quarantine, Darren, you don't have to have a doctor's note. You only need a doctor's note with an alternative diagnosis if you're symptomatic and you want to come back without doing the quarantine time. You have the choice of either, getting the test or with a negative diagnosis, or negative result, or you have to have an alternative diagnosis. But if you do the quarantine time, you don't have to have a doctor's note for reentry.
We'll also confirm that. We had a meeting today in reference to confirmation of those things too with Children's Hospital. Thank you.
I've been meeting with them weekly, so that's what they're telling us. Yeah.
Yeah, I appreciate it, Ginger. If a student tests positive, will they switch to virtual learning while quarantined? How will their lessons be provided? So if a student tests positive, they're able to switch to virtual learning during the quarantine time. The lessons will be provided virtually. They'll go through the same virtual process lessons that they are right now. I think it's the same question. If we have to quarantine, will the students be able to do remote learning? Yes, the student will be able to do remote learning when they are at home. There's a question about wearing the gaiters. We have been told that the students should wear a cloth mask and not the gaiters at this time. If we opt for the full virtual model in the survey, this is still being offered until February the 5th. That is correct. If you opt into the virtual model, it will still be offered until February the 5th. There's a question, how are the youngest learners going to be able to see the teacher's mouth to see correct pronunciation and articulation? We are purchasing, we have purchased some of the masks where the portion of the mouth, you can see the teacher's mouth. Just know those work a little bit differently. I do interpreting for sign language on the weekends. Sometimes those work really well and sometimes they do not. We are also purchasing microphones also to be able to help with that.
To them because I think that
and we also have face shields also for teachers.
They can wear face shields in addition, but they must not wear them alone. That's the.
Can you please mute your mic, please? I think it's.
Oh, sorry.
No worries.
My son.
I know, it was good to see him though. All right, it says how many students are allowed within the isolation room? I don't know if Pam is on to answer that. I don't have an answer for that one. Right now, we only have one isolation room point, but we could offer another spot for isolation. Will the slide deck be shared? Yes, the slide deck will be shared with families. Will parents know the bus schedule and routes? Yes, parents will know the bus schedule and routes. Will the virtual students have a designated virtual teachers? That's something that we're working out right now. As you know, because we have the survey data and we need that survey data, that's why it's closing today at 11:59, so that we can understand how many students are in person and then how many students are virtual, in order to determine what will be the load for teachers. We need that data. We are working to see if we can get a designated teacher, but we won't be able to decide that until we have confirmed all of the numbers. Within the classrooms, will the students be restricted to their desk all day? Students will have work in groups as teachers, meaning students will be, depending on the age group, students will work at their desks. They will have recess time. They will have activity time outside, but they would have to be within the social distancing and obviously having masks. Will there be an excused absence if there's documentation provided? It will be an excused absence if documentation is provided. Will there be adjustments to the classroom layouts, desk space, plexiglass shields on desk? So there will be adjustment to the class layouts. We've already started some of that in the pre-K classrooms. We talked about that with pre-K teachers and teachers on how to readjust the way that they teach and spacing of the desks. Plexiglass shields will be in the pre-K and K classes. So there will be adjustment to the structure. Someone said, what can we do to help? Do teachers need us to send extra cleaning wipes, masks? I thank you for asking that question. As of right now, I think we have a lot of cleaning products and masks, but we will message out to our community what you can do to help. I think during this time for teachers and for staff, it's just being able to support them as much as possible. I just got a message from our operations team, and they said if you would like to donate wipes, then we'll gladly take those Clorox wipes. Prior email stated families who opted for virtual remote learning will continue that until, I'm sorry. Prior email stated families who opted for virtual remote learning will continue that until phase 3, whichever happens first. Now we are already in phase 3.1. Will you clarify? So if you opted into the virtual model, it will continue whether we go into phase 3 or not. It will continue until February 1st. There's a question that says, what about the ELA teacher? I'm not quite sure what the intent of the question is. If you put it back in the chat, I'll answer. If you choose to go virtually initially and decide later prior to February date of the official opening, is there a possibility? So at this point, we're saying put in your choice now, because once you change, that makes a ripple effect in how many students are within a class. I know for our Johnson Café, we basically said that if it has to be on a case-by-case basis, and an emergency, something happened in your family, so you would have to send that information to us. But just know any change that you make has a ripple effect on how many students within the virtual class, how many students within in-person class. Question is, once the city is in phase 3, will there be an option for families to continue with virtual? We will reassess at that time. What can be expected about, I'm sorry. So the question is in reference to reconfiguring of classes. Will students basically have their current teachers or changing classes? Again, we are trying to determine what that will look like based on the survey numbers. We understand for teachers that it can be difficult teaching both, and so we're trying to work out a plan where there will be one teacher teaching virtually, and so classes could potentially shift. So a question is, will we be notified each week of any positive cases, quarantine classes at Lycée? We will notify the community if there is a positive case within our community. In addition, we will also notify those students or staff members which are in close contact. So it says for virtual, I thought there will be a designated virtual teacher. Why will there be recorded lessons? It will be a mixture of both. The same as the way that you have now, you have some recorded classes and you also have virtual teaching. I answered the question in reference to will students have their primary teacher? Again, that depends on the survey data. Typical class sizes, the last time I looked at survey data, it depends on the grade level. Again, we'll have to wait until we receive that data to give specifics. When is breakfast served? Breakfast will be served in classrooms. So once students arrive to school, they'll go through temperature checks and then they will receive breakfast. How will siblings be dropped off? If you have a pre-K student and an older sibling, those students will be dropped off at the State Street gate, or if you're coming through carpool, those students can be dropped off during carpool. Another question, how do we sign up for meals? You don't have to sign up for meals. All students will receive free breakfast and lunch until December. What I would request of parents is to ensure that you do, I encourage you to fill out the lunch application. So what disinfection system will be used for classrooms? Earlier in the presentation, we talked about having a cleaning schedule. Our facilities team will be cleaning the building, has a daily cleaning log where they will also be cleaning high touch surfaces. In addition to a daily schedule, they will have full cleaning on Wednesdays and full cleaning at nighttime. Bus transportation will resume the first day of school, which is October the 19th. Well, a copy of today's PowerPoint presentation, it will be available. If we opt into virtual learning, will the student have the same teacher? I think I answered that one. It depends on what the survey data provides to us. It depends on how many students are in person and how many students are virtual. If I have already completed the survey, do we have to complete it again? No, if you've already completed the survey, we have your data. Again, we appreciate parents putting in their data and providing us with their choice to go forward with either in person or virtual. Will parents be able to choose which group their child is in as far as which days they attend school? So currently we're not on a hybrid model. We're on a 4-day-a-week model. So students will come in Monday, Tuesday, Thursday, and Friday. Wednesday will be a day where students will have remote learning and some electives. For the pre-K students, they will come in on October the 19th, and those groups will be assigned and will be provided October the 15th. Students within the pre-K and K classrooms will have plexiglass during lunchtime, first and second. Also have some type of covering during lunchtime also to eat lunch. There's a question surrounding will the primary teacher change? Who will fill the primary teacher spot? We will have to provide that information once we have survey data. Again, we're trying our best to be able to provide another teacher or to be able to teach during this time, but without having that survey data, we won't know. There's a question in reference to if a parent was successful in finding new employment due to being furloughed while their child is attending in person, will you make an exception to allow the child to attend virtually as their work schedule conflicts with the school schedule? I would say send our leadership team information. As we said before, changing from in-person to person does cause a ripple effect, but we do understand there may be some instances where we might need to address those concerns with parents. The question is, I understand if you choose virtual, you cannot switch to in-person until February, but if you choose in-person, is it possible to switch to virtual? At this time, once you make your choice, that will be your choice until February the 5th. Are children still allowed to bring lunch? Children are still allowed to bring lunch. Is there a vegetarian option for lunch? There is a vegetarian option for lunch. How about the in-person schedule? I guess the person's asking what time to what time is the in-person schedule. If you're in the building, that schedule is 8:30 to 4:05. How many backpack masks should a child have on hand? Or at least they will provide them. We do have masks available for students if they don't have them. I would say, you know, have your child have one, and that's just an extra one. And there's a question about coming to school 4 days a week. Yes, all students will, if you're opting to in-person, then you will be coming 4 days a week, Wednesday being a day where you have remote learning and electives. For lunch, we will make accommodations for medical dietary restrictions. Try to go back through. Miss Katie, if you can look through to see if there's any that I missed.
Danielle, I think you've gotten pretty much any of them. Anybody who put a question into the chat and it was not answered, please go ahead and resubmit it right now.
So there's a question in reference to, can students bring their personal water bottle? Yes, we encourage then the presentation for students to bring their personal water bottle. We will be having filling stations at the school for students to fill their water bottles throughout the day during their scheduled breaks. It's a question, if my teacher was to change due to those who opted in and out, could we switch to stay with the teacher our child has had so far? So once we make that configuration, the school will be determining what teachers will stay in person or virtual. Again, that depends on the survey numbers. How will my pre-K find their older sibling? We can ensure that the older sibling is with the pre-K student. We've done that in the past, basically. And it just depends if you are picking your student up at the State Street gate or carpool. We'll ensure that the siblings are paired together. There's another question. Based on the close contact policy, if a student tests positive for COVID, will their entire class quarantine? Basically, we'll go through that decision tree. And that decision tree basically say anyone that's in close contact will go home. They'll quarantine for 14 days. And then those COVID-19 symptoms develop during quarantine. If yes, they'll follow that decision tree model. If no, they need to return to school with documentation after 14 days. Bus stop locations will be provided to our parents, anyone that's riding the bus. Another question said, what will happen to the daily ELA teacher our kinder students have had? Will the primary teacher fill the spot? So for ELA teachers, it will be an ELA teacher that will fill the spot. We'll provide more information once we have the survey data. I guess it's just a statement. It seems like there could potentially be a lot of switching of classes due to quarantine. That's potentially so. Will parents be asked to keep kids home if anyone in the household is getting tested due to symptoms, exposure, or are they staying home if they test positive? So we're admonishing parents, if your child has symptoms, then we would admonish you to keep them home. If they're not showing symptoms, or you suspect that, someone in your home, you could keep them home, but if they have symptoms, please keep them home. No worries, Rebecca. Are parents allowed to enter the child into the bus schedule? Are parents allowed to enter? I'm not quite sure I understand the question. It says, are parents allowed to enter their child into the bus schedule at any time?
Danielle, what I think she's asking is, are parents allowed to sign up for the bus at any time? And John Henry is in the call, but I would take into consideration that once all plans are made, it does take some adjustment time, but maybe John Henry wants to answer that one.
Bonjour à tous. Can you hear me?
We can, John Henry.
Yeah, so in order for us to have safe bus routing during this new normal, it is very important that if you need bus transportation, you sign up for it now. The decisions made by the deadline of next Wednesday for pre-K and K, and then Friday for everyone else, are what is going to allow me to make sure we have safe routes and to issue bus stops and bus times to all parents. Once that first route is made, it is not easy to change it immediately. So I'm asking that that sign up by this deadline is necessary from now until at least January 2021. Changes can be considered after that time, but between now and then, we'll need to stick with this first round and sign up list.
You're still muted, Danielle.
Thank you, Madam Katie, for keeping me on track. Will each class be able to open windows? Yes. The good thing about the Patton building is that it's filled with windows, so we will be keeping windows open, sliding glass doors cracked in the Patton campus. There's a question in reference to if my child has a runny nose alone, they will have to get a COVID test. If negative, will they have to stay home until the cold symptoms? We're basically asking if your child is sick, that you would have them to stay home. There is access to rapid testing if needed through Children's Hospital. Where can we make changes to the pickup options to carpool instead of walk up? At this time, we are considering going to Pick My Kid for that. We will provide more information, but at this time, you won't be able to make those option changes. We'll provide more information. On Wednesday, will it be a full day schedule at home or half day? Right now, that schedule will be provided to families. That schedule will incorporate some remote learning and also activities, STEM, PE, and music. There's a question of who is eligible for bus transportation. John Henry, you want to take that one?
Yes, sorry.
No worries.
Any student residing in Orleans Parish who lives more than 1 geographic mile away from the campus where they attend is eligible for bus transportation.
Question, will temperature check be taken prior to getting on the bus? John Henry, I think the answer to that is no.
No, will not be taken prior to getting on the bus. That is not part of the CDC or local, state, and city ordinances. As for temperature being taken at school, I will pass that question along.
Yes. So temperature checks will be taken at school upon arrival. John Henry, this is another transportation, but I think Miss Katie's on it. I appreciate it, but if you want to say it, I'll say the question, how do I access the sign-up sheet for bus routing?
You should have received an email reminder on Wednesday with our bus student handbook with an agreement on pages 10 for English and 21 for Spanish. That needs to be filled out and returned. Information about how to return that is in that email. If you have not received that email, please email transportation@lfno.org. I'll include that email address in the comments shortly.
Thank you, John Henry. I have a couple of more transportation questions, John Henry. I think I can answer it, but please jump in. Will there be an adult assistant on the bus with the children during routes?
We will not have bus monitors unless such an accommodation is issued through a 504 or IEP plan. The bus driver is informed and will be informed that students need to have assigned seats, and to help us in our efforts to keep everyone safe, making sure students maintain that same seat, social distancing as much as possible, air ventilation as much as possible.
Thanks, John Henry. There's some questions surrounding, if a child has a fever on a bus and potentially expose other kids, we would really point out to parents, you know, before your child leaves home, you know, you just want to be able to check your child to kind of see how he or she is feeling, to ensure that, you know, if they're sick the day before, or you see that they look sick or having some symptoms, that you stay home. This is a lot that we are, Children's Hospital has basically been telling us, like, if you're sick, we're encouraging you to stay home. Another question about busing is, are kids bused together by grade level or by address?
Based on the current guidelines from the CDC and Louisiana Department of Health, we are limiting the bus capacity by 50%, but we'll be assigning routes based on geographic locations, making sure that kids don't have to spend too long on the bus. It would be logistically infeasible to bus kids by their pods or grade levels.
I don't see any other questions within the chat that we haven't addressed.
Quick question. It's easier than typing it in. If a positive student is found on the bus, then the bus will then be notified, but then will all the students from each of the classrooms, that all of those bus, you know, that networks out.
Yeah, thanks for the question.
How would that be handled?
Yeah, thanks for the question. So it goes back to the decision tree model, basically. If a student is tested positive, then any student within that close contact will be notified, basically. And then the whole community will be provided information, not specific to, you know, the students on the bus, but just as a community also. Another question, when do you expect to have kids reassigned to classes and have in-person virtual classes redesigned, and how will that be communicated? That will be communicated this weekend. Again, we're waiting for all of survey results to be in. Again, parents have until 11:59 p.m. today to turn in their survey results. What are the general rules for kids at recess? I'm assuming that's in reference to like social distancing and wearing a mask. We will be going over those general rules with students. We have basically divided up the spaces that we have at the Patton campus for recess. We will have access to the St. Paul facility also, and we'll be roping off certain sections of the playground for students to play with their cohorts. Masks are required at recess. John Henry, do you have an estimated information on bus routes?
Information for pre-K and K students should be available by the 5th. I know it's a tight window and I apologize, but by the 14th or 15th. For other in-person grades by the 19th.
Thanks, John Henry. Will there be a monitor in the isolation room? Yes, there will be a monitor in the isolation room. If a doctor note is required to excuse an absence, do you think parents will be likely to keep their children home if they're sick? I do understand the question. Children's Hospital, and this is what basically the medical experts have been saying to reduce community spread. If you are sick, we are asking you to stay home. So if one of your children tests positive and others do not show symptoms, I would encourage you to get your children tested. Again, there are rapid testing through Children's Hospital, and there are free testing sites around the city. That's a good idea about eating outside. We are preparing stations for students to eat outside and have some type of classroom activities outside as much as the weather will permit us. A question is in reference to how do you ensure no child is left behind on the bus when there will not be an assistant on board, as the younger students can fall asleep during the route home and adjusting back to the normal school hours? What John Henry, you can add to this, but I can answer it. And Miss Katie just answered it too. Typically on the bus in the mornings and in the afternoons, during drop off, what the bus driver does is the bus driver checks every seat, walks to the back of the bus, checks every seat for any things that children have left. And then they basically let a staff member know in the morning times. And then once they clear their route, also, they're supposed to check the bus also. John Henry, you have anything else to add?
Yes, I will be sure that this year, not only will the bus driver walk and check his bus for students and safety, but also a school-based monitor will walk the bus checking seats for any children that need to get off at that campus at every unloading of every bus.
Thanks, John Henry. In relation to, I guess someone asked about attendance. Will the attendance policy be different during this time? Will it be more lenient? So our attendance policy is based on what's provided by LDOE. If there are any changes to the attendance policy, then we will provide that to families. We all know during this time, during COVID, we basically provided the attendance policy for virtual, that we allow parents time until Sunday night to be able to finish activities for attendance. If that changes for in-person, we will provide that information. How about uniform protocols, please? So in the beginning presentation, we talked about uniforms. And so for uniforms, students are able to wear the red or white shirt with a logo. However, if you do not, students can also just wear a red and white shirt and blue bottoms also.
And I'm going to follow at Danielle's point. No light up shoes, no shoes that make noise, no shoes that roller skate down the hallway.
Yes. Sick teachers or teachers with a sick child, will a substitute be provided? So in a typical setting, when teachers are in person, if a teacher is sick, then we provide a sub. I'll do that 8-second teacher rule. I'll wait about 8 seconds and see if anyone else has any questions or concerns. I just want to thank parents for being on this call. I know it's difficult to be during this time. I am a parent, so I definitely understand on both sides. I thank you for all that you do as parents. I thank you for allowing or sharing your children with us. It gives Miss Katie and I and all of our staff great joy. We're smiling now because we can't wait to see kids, whether it's in person or on virtual. And if you have any questions, just let us know. We'll be happy to answer.